Hello, everybody. Welcome to the Eat, Play, Love Fall series. I'm Rachel Atkins, Director of Strategy at Obesity Matters, and I will be hosting the session today. Obesity Matters is a not-for-profit organization for people living with elevated weight and obesity. It was formed by patient advocates whose focus is to provide evidence-based education and advocate for public policy and environmental changes that enable well-being. If we can do that, we are one step closer to the acceptance and inclusion of millions of people in larger bodies. The Eat, Play, Love Fall series runs weekly interactive events with experts. The first half of the episode is an interview, and then we turn the spotlight over to you for questions and comments, and we provide a safe and supportive environment to do that. This season, we want to reflect on our transition out of the pandemic. Hopefully, we have survived, we've thrived, and we've transformed the normality of our lives over the last few months. And because of that, we are more thankful and mindful than ever for our health and how far we've come in our journeys. Today, our special guest is Dr. Florencia Ziemke, an obesity medicine specialist who is passionate about nutrition, health, and wellness. The conversation will focus on lifestyle and behavior, a major component of wellness and weight management. Inspired by the book Breath by James Nestor, Dr. Ziemke will discuss what and why this is included as part of a successful and sustainable weight management program. Florencia, we're so thrilled to have you with us. Can you tell us a little bit about yourself and your areas of specialty when it comes to obesity management?
Yes, absolutely, Rachel. Thank you. You know, the honor is mine. Thank you for the invitation. I have to say from a very early stage, I recognize the impact that this complex metabolic disease had on family and loved ones. I can say throughout medical school, I was fascinated by the biology and physiology of nutrition. At the time, of course, I recognized the lack of understanding we had. It was nothing to compare to what we know now. But I also concurrently witnessed the impact that focusing just on a physical body had. I spent most of my career years in Boston, Massachusetts. I have a background in board certification in internal medicine. I completed a fellowship in clinical nutrition and metabolism, and I'm also a diplomat of the American Board of Obesity Medicine. I participated actively in many clinical trials looking at medications that are now FDA approved and available on the market for the treatment of obesity. And if we fast forward to the year 2021, I live a little further south than Massachusetts. I'm actually in Florida, and I'm the founder and chief medical officer of Avexia Medical, a nutrition and weight management practice that serves the Palm Beach County area.
Wow, so thrilled that you are with us. That's a lot, and we have a lot to learn from you. So why Breath? What inspired you about this book that James wrote?
Right, exactly. And so, I love to read. I'm a lifelong student. I make an effort to read during my free time outside the scope of what I typically read, medical journal or textbook for nutrition. As part of my job on a daily basis. And this book was recommended to me. And what inspired me about this book was, so number one, all the analogies I found with eating. And then number two, the emphasis on the importance that lifestyle and behavior play on our health. So I need to disclose to the audience, I'm not here as a breathing expert. I am not a breathing expert, but as an obesity medicine specialist, I make it my mission to emphasize the importance of steering away from the concept of eat less, move more, right? I emphasize the point of steering away from the concept that obesity is a matter of willpower. Obesity is complex, it's metabolic, it's chronic, it's progressive, it's relapsing, and it needs to be managed as such, right? We have the advantage of understanding the physiology a lot more. And we know that a stepwise approach based on this physiology needs to be taken. And when I mean stepwise approach, some of the tools we have are diets and medications and surgeries and combinations of those. But the foundation of this stepwise approach needs to be the lifestyle and behavior. And I found this book really interesting. I think it was eye-opening. I recommend the audience read about it, but I am here to talk about the lifestyle and behavior component of nutrition and weight management.
Oh, that's very interesting. I'm so curious about the role of breath. Specifically, though, maybe to get us started, I can point out in the book, James actually clarifies some myths and conceptions about breathing. And one of the myths is breathing is breathing for 20 minutes or 10 minutes, and either through the nose or the mouth or a tube, it's all the same. The point is just to get the air in. Is this the same or true with eating? Is eating just eating? Is it about getting the food in?
Yes, Rachel, that's great. And he does, in fact, he talks about this. Many people think breathing is exactly that. Do you do it through the nose, or you do it through the mouth, or a breathing tube? It doesn't matter. Just get the air in. And I get this question a lot. I get the question, why do I have to learn to eat? I've been doing it all my life. It's just a matter of getting the food in. And quite frankly, it's not. Eating is not just eating. Now, although we understand that obesity isn't a matter of energy in, energy out, this is not a linear equation. By altering, one of those components, it doesn't make weight go up or weight go down. It's not a matter of restricting 500 calories and sustained over several days. 7 days, 500 calories, 3,500 calories, that's equivalent to losing a pound. We understand that physiology does not work that way, right? We know that there are counter-regulatory mechanisms that come into play as soon as you start restricting that diet. We know that the body defends its set point, right? It fights this weight loss. So no, eating is not eating. And I think, we could have a whole separate talk on the different types of diets and medical nutrition therapy, of course, but I think it's important to point out two things. Number one, we build a lifelong relationship with food. This is not something short-lived, right? We are looking for long-term chronic management of a complex metabolic disease. And in general, focusing on the eating, I guess we can say a rule of thumb that applies to all is avoiding processed and ultra-processed foods. And I think that's about as much as I'll say about that. But the other important point is that regardless of the dietary intervention, regardless of the eating, these changes will not occur unless we include the lifestyle and behavior change.
That makes a lot of sense. This question too also makes me think about something that I've always had challenges in chewing my food when I was younger due to dental problems. And I think I've, now had to learn how to chew food now that I've had some of those things fixed. So it's not just about getting the body in your system. It's even like how it gets there. I'm now curious about, what is wellness and what does wellness have to do with weight management? You've touched on that topic a couple of times.
Right. So wellness, wellness is a term that's thrown around a lot. And when we speak of wellness in medicine, what we refer to is the integration of multiple domains to come together and create a whole. And these domains refer to the physical body, of course, but we also include the mental, the emotional, the social, the environmental. All of these factors need to come together to define our wellness. And what I find, over the years in this field is that weight management, in that sense, similar to wellness, is an integration of multiple aspects of treatment looking for long-term change. And looking for the outcome of overall health, right? It's not just about numbers on the scale. It's not just about food in, food out. It is the integration of multiple components. And so I think, the first line of treatment, again, I can't emphasize this enough, the first line of treatment for any long-term weight management, and similar to wellness, is focusing on the lifestyle and behavior.
Yeah. And I think probably there's a little bit of a need for all of us to slow down a little bit and maybe be a bit more patient as opposed to jumping into those things that are supposed to have this immediate impact. It's thinking about, I want to be in this for the long game. So specifically, can you dive into how does altered lifestyle and behavior affect weight management?
Sure. And so when we speak of lifestyle in general terms, we refer to physical activity, to sleep, to stress. These are some examples. And when we think of behavior, what we're looking at is the how, why, what we do, the things that we do. So first, let me point that out. And why does altered lifestyle affect weight and weight management? And so lifestyle per se, I won't get into the physical activity. That's a subject for a different day. But if we take a look at sleep, right, we know there is data to support that even partial sleep deprivation causes changes in hormones that modify our appetite, modify our energy expenditure, and are tied and linked with obesity. Partial sleep deprivation. And if you take a look at stress, right, I'm not talking about the acute stress, I'm talking about chronic stress sustained over time. So the same mechanisms come into play. There are hormones that are altered that regulate appetite and metabolism, and then over time they cause insulin resistance and obesity, which are both very, very closely tied together. And that's just focusing on altering the lifestyle. If you take a look at the behaviors, right? Remember that the behaviors are the why, what, and how we do things. I think first it's important to point out the body, the physiology. We need to understand that there is central regulation of energy, right? The brain is involved, not only the peripheral organs. And in the brain, there are two systems that are on at the same time. One is the homeostatic, right? Homeostasis, the basic necessity, the source of energy for survival. But at the same time, we also have a system that is the hedonic, right? Hedonic reward. It's driven by sensory perception. It's driven by pleasure, palatability of food, right? And the hedonic system is typically turned on in the absence of physical hunger. So that's behavior in terms of the physical, the physiology. But then when we look at behavior from the emotional, from the social, from the environmental, right? Why, how, what are we doing what we're doing? You look at emotions, right? What is dictating that eating behavior? Is it a surrogate for affection of self or of others? Are there perhaps certain triggers? We heard a little bit about the Pavlovian responses last week, right? Are there triggers that dictate that eating behavior? Is it a holiday season? Are we celebrating something? Is it the environment? What's going on in the environment? Are we eating because other people are eating? Are they handing out free food? Is it a buffet? Now with COVID, we may not have as many buffets, but is it a buffet? Is that why we're eating? And the social aspect, of course, it focuses more on where you eat, who you're eating with. I know Obesity Matters has had a wonderful Monday mem. I remember it was about serving plate on a food and make sure you sit down and have that interaction. But the aspect of the social drive for behavior that is very near and dear to my heart is the information gap, right? There is too much noise. There is a promise of elusive weight loss tricks, fads, marketing strategies. It seems even something like food labels and grocery shopping has become more and more difficult for the consumer. And these things all come together and can drive our behavior for eating. And I think in relation to the book, right, going back to the book, what we do know in terms of behavior, if you take a look at breath work, right, breath work, meditation, another word for slow breathing is prayer. So regardless of your religion and your culture, this is, breath is with us. what we know about the benefits of breath work is that it decreases stress hormones that are involved in appetite and metabolism regulation. It improves our ability to make decisions. It improves our ability to plan. It improves the concept of self-worth and self-image, right? These are all very critical components of our lifestyle and behavior that have to do with our wellness and are important in weight management.
Wow, that's so good. So are there some specific behavior change techniques that are emphasized or that you would emphasize in weight management?
Oh yeah, there are many. There are many that we can talk about. Absolutely. So I think before we start talking about behavior change, one and if not the most important question we should ask ourselves is why, right? Why are we looking for this behavior change? What is the goal? And with that answer, we should create a plan, because every step in the right direction counts. Behavior change does not happen overnight. This is something that takes time and is complex, right? And once we've answered that question, there are several techniques. I think an important one to point out is, for example, mindfulness meditation. Mindfulness meditation, for those that aren't familiar with it, was founded by John Kabat-Zinn, based out of the University of Massachusetts. It is the concept, and he uses breath work, but it is the concept of developing active awareness and perception, right? Attention and perception in a non-judgmental manner. And I guess the best example, or at least I always use, is when you're in the shower, right? You're in the shower. Are you thinking about the water falling on your head, or is your mind rambling on about the laundry list of things you have to get done, right? So mindfulness focuses on bringing our attention and our awareness in a non-judgmental, right? A non-judgmental form, which ties in very nicely with another technique that focuses on compassion and self-love. Now, compassion and self-love, I guess the best way to explain this would be to ask yourself, how do you react when something goes wrong? How do you treat yourself? Do you beat yourself up and feel like you're a failure? Because too often at times, the reaction is perceived inadequacy, right? A sensation of failure. Oh my goodness, and where we try to shift the focus is more towards compassion, self-love, self-empathy, right? Allow yourself to do this and be aware of it, but with empathy, with compassion. And this ties in very nicely to another one, which is focusing on positive change. Behavior change does not happen overnight. There are people that are born with certain behavior skills, but guess what? These are learned behaviors, right? These are skills that we can together as part of your integrated weight management plan or lifelong plan, right? Because this doesn't even apply only to weight. And another technique I love to use is the 80-20 rule. I don't know if you've heard of that, Rachel, and I can't see a show of hands from the audience, but so the 80-20 rule focuses on try to stay on track 80% of the time, right? Because remember, we are looking at a lifelong change. Obesity is chronic. We are looking at a life-term relationship. We are looking to build healthy habits. So try to stay on track 80% of the time, right? Allow yourself to steer away that 20% of the time. I think, and of course, the advantage we have in the year 2021 is that we can leverage digital technology, right? But back in the day, we couldn't, but now there are resources, there are user-friendly apps, there are digital devices. There is artificial intelligence software. They're even, looking at devices, virtual reality devices, to help modify this behavior.
Oh, those are really good techniques. Thank you for sharing that with us. So, the last question I have for you before we hand this over to the audience for questions is, what support do you feel that Obesity Matters can offer to our community?
Rachel, if I hope that if there is one thing that I have made clear today is that obesity is complex. Obesity is complex and it takes a village to treat this. And Obesity Matters and its community are part of this village. Continue to provide the safe environment. Continue to advocate weight management within the context of wellness. Continue to emphasize that this disease is not a matter of willpower. I think you can create educational resources for the community to help tune out the noise. I think you can create tools for your community to help empower them with different techniques, some of which I briefly touched upon. And I think most importantly, you can continue to serve as the evidence so that together we can continue to build a lifetime of health as a whole.
That's wonderful. Thank you so much. So the floor is now open for audience questions. We will alternate between live questions and ones in the chat box in order of relevance. We encourage you to turn on your camera when you're ready to ask your question, introduce yourself, let us know where you're tuning in from. Please raise your hand virtually using the Zoom feature, and you can always let us know in the chat box if you're having trouble doing that. So I'd love to start with what's going on in the chat box, Rosie.
Thanks so much, Rachel. So far, there's been lots of listening and also some suggestions on different types of breathing apps and techniques that people are using. There haven't been any questions that have not been answered yet. There's just a question about the author of the book. So the floor is open for questions. Maybe a good place to start, Dr. Ziemke, would be around, how do you suggest people start? It can be an onerous, overwhelming type of sensation to feel, where do I start to take control, and what are the success factors in terms of my journey?
Absolutely. So, I can share an example I use with patients because I get this question a lot too. They'll tell me, I don't breathe, I don't meditate, I don't practice yoga, right? We have this false sensation that yoga is, I'm not even religious, I don't pray. And so I say, it doesn't matter, the breath is with you. This is a tool that you have. And the best way to do it is, I say, it's not about focusing on the ins and the outs, right? It's not about the wins and the losses. It's about showing up as the best possible version of yourself. And this is a dynamic process. Not every day is the same. And again, the 80-20 rule, not every day are you going to feel at your best, right? So show up as your best possible self. And when life gets complicated, because life does, it's the way it is, and it's the beauty of it, go back to the basics and start by paying attention to what your breathing is doing. Are you, huffing and puffing through the mouth? Are you breathing through the nose? Do you feel nervous? Just pause for a minute and notice what your body is doing. This is a very, this is a very simple technique. Nobody even has to realize that you were doing it because you were bringing that awareness inward. Pay attention to what your body's doing. That's typically my first step and recommendation for somebody that has had no experience.
Rosie, over to you. I think I did notice a question in our chat box.
Yes, thank you. It was a follow-up, I believe, to what Dr. Ziemke is describing. The question is from Cindy Getz, and Cindy asks, how do we change that mindset to the 80-20 rule? I've always been all or nothing, and when I cheat, I throw the baby out with the bathwater.
Yes, and so it's an absolute change of perception. When we realize that this is a lifetime of a healthy relationship with food, when we realize, I use the word journey. I use the word journey because this is not supposed to be a 10-day thing, 20-day thing, 30-day thing, right? It is shifting our focus, bringing our attention inward, and allowing for love, and compassion, right? I recommend starting with mindfulness meditation. And the reason I do that is because, and there are a whole bunch of apps we can share my email and in the chat box if we don't have time to get into these, but there are several apps and recordings that are free, and I recommend them to patients. But mindfulness meditation has very short guided breathwork exercises. They're anywhere from 6 to 9 minutes. And I say, listen to it, see what your body does. And the majority of times, for the first week or so, people will be listening to them. And again, their mind is, it's difficult, right? Their mind is rambling about something else, or they're thinking about everything they have to do or they did. And it's just a matter of practice. And when we focus on the compassion and self-love, understanding that it's okay to feel this way, or I don't have the energy to log today, that's okay. It makes it more sustainable over time.
That's great. Do let us know if you have a question that you're comfortable asking live. You can raise your hand. And as I mentioned, you could also indicate in the chat box if you're having trouble doing so. I do see another question that's popped into the chat box, Rosie.
Okay, great. Thank you. Joy D asks, how do you keep motivated when it's been so frustrating, even on Saxenda or weight management treatments? I would feel hungry, and sometimes so hungry, no matter what I ate that day was not filling me up.
Right. And so I think it's important to first understand that it takes a village. I go back to this and I say this over and over again, because it takes a village in the sense that for weight management, you need a team of medical doctor, nutrition specialist, life coach, motivation, apps. There's so many different tools, and we have to integrate these components, right? It's not loading these changes on your shoulders, right? I think it's important to establish a relationship with your healthcare team, where you can talk either to your doctor or your nutritionist, or I can tell you in our practice, each patient is paired with a life coach to drive that motivation and change. And again, 80-20 rule. If you are having trouble with your medication, this is something that you need to address with your healthcare provider, because we can adjust that or try different ones. If it's a matter of the diet or compliance, or you just don't like it, right? It doesn't work for you, that's okay, but we need to communicate that and ensure that you feel comfortable and supported by the team that is helping you through this difficult disease.
Great. As we're waiting for someone to ask a live question, I'll go ahead and do so if that's okay. I'm curious. I have been following the author for a while now, and he does talk about this really controversial tip and technique. You touched on earlier the fact that our sleep is so important from a weight management perspective. And then also, something that's happening while we're sleeping, our breathing is also very important, as we know. So many of us in this community, myself included, have sleep apnea. And so he talks about this idea of putting a little bit of tape over your mouth to encourage you to breathe more from your nose. Actually, I'd love to know if anybody in the audience has tried this technique. And have you tried this technique? Tell us about it, Florencia.
Yeah, so first I'm going to disclose, James Nestor goes through quite extreme experiments to prove the point, and I don't recommend trying them at home. This is the first thing I'm going to say. He plugs his nose for a while and then his mouth, so I certainly don't recommend trying that at home. But the results of the science support that, right? The difference in the metabolic differences from breathing from the nose or from the mouth. And I can't speak from the breathing perspective, but I can say that sleep apnea is very closely tied to obesity and comorbidity or vice versa. So there are many different exercises in the back of the book. He even has some YouTube videos. I do not recommend you tape your mouth or your nose. Please don't do it. But some of the breathing exercises, trying the different nostrils, and even something, you know, there's one simple technique. It's called the rainbow breath, right? You pause throughout your day. This is something easy and that I recommend doing. We should all pause throughout the day at any given interval. I typically recommend every 90 minutes, and just the rainbow breath is just stretching your arms out and bringing them together, just like make a rainbow shape, and pause, quiet your mind, try to forget about everything that you were doing and just focus on your breathing, right? This is a technique I recommend, but not the taping the nose. And no, I haven't done it myself either.
Okay, great. Then maybe I won't try it, but I love the rainbow breathing. That sounds really cool. Rosie, back to you. Yep, sorry.
Yeah, no, I think it's, again, going back to this 80-20 rule, going back to the self-love, self-compassion, and self-empathy. It's really important to understand that it's okay to allow us time to take a break, right? The founder of mindfulness meditation, John Kabat-Zinn, which I mentioned earlier, actually always says that we shouldn't be called human beings. We should actually be called human doings, because the thing we know how to do the least is to be. And he gives an example, and he says, when somebody is speaking to you, is your attention active and perceiving that person that's speaking to you? Or in your mind, are you already thinking about questions you want to ask? Now, if you stop and focus on this, by not actively listening, by not pausing and allowing to place your attention on the person that's speaking, this is a perfect example for this presentation, right? By not focusing on what I'm saying, your mind doesn't stop, right? You're constantly thinking about this and that, and should I say this? And when you pause and you focus your attention on the person speaking or on the water in the shower, then you are being, you're not doing. I hope, that's.
Yeah, no, I love that. I love that. Rosie, I saw a couple of things pop up in the chat box. Anything you'd like to share?
Yes, absolutely. Kathleen Budd asks, how can mindfulness be effective in countering the long-term effects of sleep loss and chronic stress from a lifetime of shift work?
Right. So shift work, and again, similar to partial sleep deprivation, we know the detrimental effects on hormones and in relation to appetite and metabolism regulation. We know that these changes lead to long-term obesity, insulin resistance. And so many studies have been done on this. Now, mindfulness meditation, in the sense of breathwork guided, directed attention to help soothe and counteract the effect of these stress hormones, right? To empower yourself and build that self-awareness, compassion, image of self, to build your capacity to make decisions. And again, to begin this daily ritual, if so, right? To begin this daily ritual of behavior change. I hope that, as best possible and in short amount of time was able to address that question.
Yeah, definitely. We do have someone that's raised their hand. Michael, would you like to unmute yourself and tell us where you're tuning in from?
Yes, good morning or good afternoon. I'm Michael Bidu. Nice to see you, Dr. Ziemke, on this wonderful panel or event with Obesity Matters. The question that I have you, since we're talking about breathing, one of the technologies that is extremely efficient, I believe, and the research shows that, is virtual reality. Have you tried virtual reality with any patients, or are you aware of some programs or products out there that can help people be in virtual reality and therefore have some breathing exercises that are probably, even better than in the real world. So that's the question.
Yes, absolutely. And so going back to a little bit of those behavior techniques that I touched upon and the advantage of being in the year 2021, where we can leverage the exponential growth of this digital market. And as Michael was pointing out, there are different devices that we now have access to, and they can range anywhere from a simple user-friendly app to do some of the food journals, artificial intelligence software for food analytics, smart scales, digital devices that allow us to do remote monitoring, and the more fancier, tail end of a novel device uses virtual reality through these video game eyeglasses is what I call them, and places that person in the situation with the aim of modifying that behavior. Michael, I'm not the expert in virtual reality. I can tell you that the data so far is promising. The more resources and technology that we can use to help emphasize these behavior changes in lifestyle skills that I have talked about today, the better. And again, we need to leverage the growth of this digital technology. I think it's a very promising future. But I haven't tried it myself or in my clinic.
Thank you. So I think that is actually my point. Is we have excellent obesity experts such as yourself in the United States, in Canada, who understand the power of the technology. But we need to bring researchers who have been in this space for quite a while, who have done research and have clinicians working together with those types of researchers from all sorts of universities in the United States, in Canada, and the world, to actually come up with new products and services that can actually benefit the patients, in this case, obviously people with obesity. So I think that's what I see going forward is research with medicine, with innovators in technology to actually work together to come up with new solutions to actually, help more and more people at scale.
Thank you, Michael. Rosie, back to you. Anything else coming up in the chat box?
Yes, thank you. There's lots of questions around how breathing can help manage weight loss. And one question that's very specific is from Marianne asking, how can we manage cravings?
How can we manage cravings? Yes, so we do have, again, remember, I go back to the stepwise approach in terms of weight management. So it's the integration of multiple components to find the long-term success. And so medical provider now has the ability to prescribe medications to specifically target cravings. But in the meantime and in parallel, we go to the behavior part. What are some of the behaviors? So I think that in order to solve a problem, you first need to identify what's causing this, right? And so this goes back to the concept where I said, understand where your starting point is. Are you the type of person, for example, that eats out 5 of the 7 days of the week? Or are you the type of person that loves cooking and has every gadget in a ginormous kitchen? Or are you the type of person that could care less and doesn't want to see a kitchen? So that in terms of understanding where you're starting, and also try to identify in journaling is not for everybody, but try to identify what triggers are causing this. Is it an emotion? Is this craving tied to perhaps a social event? Is it an environment? Do you find that your cravings or worse, after you have lunch with a certain coworker, right? So it's always important to try to understand what's causing this. And once we can understand the cause or the link, and of course, if you don't know, seek help from your medical team. The behavior and lifestyle change isn't only self-guided, it can be professionally guided as well. Motivational interviewing, cognitive behavioral therapy are tools we can use from the provider side. But once you identify what's causing these triggers, then we can use different techniques. But first, ask yourself, what is causing it?
I love that idea of checking in with yourself. Back to you, Rosie.
Great, thank you. And we're getting some great feedback as well from the participants in the chat box, talking about finding journaling has helped bring out emotions and helped has helped Michelle lose weight. And there's also references to looking at food not necessarily being the fix as to what's going to help you with a challenge that you have, looking more for support from others, sharing your situation with others who are going through similar experiences might be helpful. Joining a support group might provide with more new ways to cope, and that's courtesy of Lou. So thank you so much for sharing your feedback there. Kate Farsky asks, I think there used to be some research years ago using aversion therapy. Is there anything new there?
So I can't comment on that. I'm happy to get, do some further research, and if they want to send me an email, I'm not an expert in that area sufficient to answer. Do they have a specific question about aversion therapy, or?
Kate, if you'd like to ask something more specific, we can see if we can answer your question. Would you like to raise your hand?
And they can always send me an email. I don't want to put anybody on the spot, certainly. Yes.
Just in general is her comment. So, okay, so just in general then, Dr. Ziemke, I was happy to look into that for you and get back to you. Rachel, there's nothing else in the chat box at this time.
Okay, great. Oh, I just saw that Joy asked a question.
Perfect. So Joy, thank you. Joy's asking, does deep breathing help with weight loss? Can you expand on the breath work? Why is this so important, and does it help with other things?
Right. And so, there isn't just one thing that helps with weight loss. I think the emphasis, at least from my perspective, this talk was generated as an inspiration from the book. I read the book during my free time, and I think it's eye-opening. The experiments are quite gruesome and extreme. I don't recommend them. But what I think is important is the emphasis on lifestyle and behavior as part of weight management program, and why breath work is effective. Breath work and also meditation, and another form of slow breathing is referred to as prayer. Why are these things important? And so there is evidence that supports, and we know that the benefits are, again, reducing stress hormones that are counter-regulating and creating insulin resistance, obesity, that we talked about with sleep and with stress. The other thing is that the spending the time to breathe, spending the time to meditate, to pray, to focus on yourself leads to compassion and self-love. And remember, it all starts here, right? We focus too much on the there, but it all starts here. And so when you allow yourself to feel, to be, when you are in tune with how you are feeling, what your breath is doing, are you hungry, or are you eating because it's a free cookie you're getting, right? All of the self-awareness and attention to self and feeling just contributes in terms of building those skills towards our eating, towards our meal habits, towards our planning, and even meditation. When I say meditation, I refer to breath work, meditation, prayer. It's even demonstrated that it improves our capacity to make decisions. it improves our problem-solving skills.
You know what I find interesting about this whole idea of breath is that, you know, using it in the right way and following some of the techniques that you've talked about it's free. And maybe that's why we've not seen a lot of emphasis on it. But I certainly know I'm interested in trying some things. Let us know in the chat box if, you know, this might be something that you're going to try for yourself as well. Back to you, Rosie. Is there anything else in the chat box?
Not a question, but there's a great comment about someone having experience adding healthy behaviors and food choices rather than denying or prohibiting specific choices or behavior, having that positive reinforcement rather than punishment. Thank you so much, Niece Leah, for that, that feedback. Very helpful. I do have a question for you, Dr. Ziemke. So personally, I have tried meditation in the past, and I have to say, I didn't find a very good fit with it for my personality. I did find it hard to focus on the music or the conversation. I personally find walking, getting fresh air helps me focus with my breath in a more effective way. So for others who may be wondering, what's the best approach for approaching how to manage breathing in a more focused and controlled way, what would you recommend as a first step?
Absolutely. And so meditation isn't for everybody. And that's a great point. Thank you for bringing it up. When you're walking, right, if you prefer the feeling of fresh air or getting up or stretching, right, just pay attention to your breathing. Just notice what you're breathing and doing. And that in itself is a form of meditation. You don't have to listen to the guided meditation. This is an example. Meditation and spending time with yourself, paying attention to what's going on inside, pausing, right? If you're getting ready for a presentation, for example, I can use today as an example. So, but before coming on screen, I just pause for a minute and pay attention to what my breath is doing. When you're outside walking, pay attention to the breeze in your face. Pay attention to the leaves that are falling. Pay attention to the sound of the grass or street that you're walking on. Meditation, you know, similar to mindfulness meditation, refers to bringing the awareness and the attention inward in a form that is present and non-judgmental. So it doesn't necessarily have to be in a dark room sitting on a mat. It doesn't have to be listening to music and somebody telling you, you know, now do this and do that. We can work at bringing the awareness to ourselves. You could do it at any time. You know, you should be doing it now as I'm speaking, right? You should be bringing that awareness and allowing yourself to be present. We are here. We are here now. We're not there. It's not, we are here. And learning that behavior, we have shown over time that it builds techniques and it drives our behavior to make better decisions in many aspects of our life. So just paying attention, just bringing that awareness inward. And the best part is you could do it without anybody noticing, right? If I'm doing the rainbow breathing, right, everybody around me might turn around and look, but just paying attention to that breathing and bringing it inward. Start by noticing that. And my first homework assignment for patients is always that shower exercise. I say, next time you're in the shower, I want you to pay attention to what you're doing. Are you paying attention to the water, or are you thinking of everything else that's going on?
Thank you so much for making that so much more approachable, because it does feel like a very lofty thing. Rosie, I did see another question come up in the chat box.
While Dr. Ziemke was giving the example, there was a question that was coming in saying, what examples do you give patients? So other than the shower example, do you have others that you can help describe this for patients?
Yes, and so another example I use, and I'm a big advocate of focusing on the positive. of using the 80-20 rule in building compassion, self-worth, and self-love. This is, we are beginning a journey together. And I say journey because this is different probably than anything anybody has ever told you about your weight. This is this is a new beginning. And I say, I'm not here to focus on the food in and food out. It is not about the wins and the losses. It is about being the best possible version of yourself. This is a technique that will take time. This does not happen overnight, but I will be with you every single step of the way, holding your hand. And so will the rest of the team. And so will your community. Obesity Matters, your family, your friends, whatever community each person has, supporting them throughout the journey. This is the lifelong relationship with food. And I say, the second homework I give them is to ask themselves how they react when something goes wrong. Because this, and I invite the audience to do the same. Are you the type that beats yourself up because something, you spilled coffee all over your shirt, and so, oh my goodness, or do you say, well, I guess I have to change, right? These are small techniques and changes that focus and drive behavior to build awareness, self-love, compassion, that are tools to help the long-term success of weight management.
Really helpful tools. Rosie, is there anything else in the chat box?
Just a comment from Michelle Shapiro, be thankful we're alive with COVID.
I think that's a really good comment to sort of wrap up today's session as well. First of all, Florencia, I really like to share with you that we thank you greatly for being so generous with your time today. In terms of, a major takeaway for me, it's going back to that really powerful tool of mindfulness meditation, and knowing that I can do it, out walking or in the shower, or there's a lot of other ways to do it. It's much more approachable than I think a lot of us think of it as. So I would like to end today's session by saying, get involved as a member of the Obesity Matters community. We will be sending out a survey and would appreciate you completing it so we can continue to build these programs based on what you would recommend and what you want to know more about. Be sure to tune in to our final episode of this fall series on Thursday, October 7th at noon Eastern. How to practice mindful eating at Thanksgiving with patient advocate and culinary nutritionist Tony Vassallo. Thank you so much, everyone. Until next time, I'm Rachel with Obesity Matters.